Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Lyft Healthcare, welcome and thank you for joining us. Today's webinar focuses on a topic of critical importance for healthcare executives, understanding consumer expectations for their healthcare journeys. You'll have the opportunity to examine how Ballad Health approaches consumer understanding and uses the insights to plan and execute market strategy. Here to share Ballad's health journey are Molly Luton, Chief Marketing and Communications Officer for Ballad Health, and David McDonald, Chief Executive Officer of Lyft Healthcare. Also joining us is Phil Ritchey, Chief Growth Officer for Lyft Healthcare, who will moderate today's program. Before I turn the program over to our speakers, one quick note. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. We will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Phil.
Thank you, Daniel. I appreciate that very much. I want to extend our thanks to the forum and, of course, to all the attendees today. We want to extend our gratitude for your time and interest in being here. We're extremely proud and honored to take you on this journey today. My name is Phil Ritchey. I'm the Chief Growth Officer at Lyft Healthcare, and I'll be your mountain guide for this journey today, taking you through this discussion and really learning a lot about Ballad Health's approach to consumer understanding. We are blessed and lucky today to have Molly Luton, who's the Chief Marketing and Communication Officer with Ballad Health, and it's really, her journey and insight that she'll be sharing with us. And of course, my good friend and colleague, David McDonald, the Chief Executive Officer at Lyft, will be joining in and talking about the role insights or deep understanding of your patients and humans in your market and what they are really looking for to access and get excellent care from your markets. So I thought to get us started, I would give a little bit of context for what we're going to cover today. So in our agenda, we're really looking at this spectrum from Ballad Health's perspective and really their philosophy in approaching a deep understanding of their patients through insights. So learn how Ballad Health strives to understand the consumer's why before the how in their strategic planning. Then to the next step, strategy. So really, how do you create buy-in internally and build a consensus with your colleagues and implement an integrated strategy like this that can touch really all elements of your goals and objectives for a health system. And then how do we bring that across the goal line into execution and bring it to life in a fiscal year marketing plan? How to align your internal and external partners for the ride. So these are the three pillars that we'll be covering today that will take us on this journey. To get us started, I'm really excited to introduce my good friend, Molly Luton. Molly will tell us a little bit about Ballad and the journey that they're on and sort of set the stage for their approach to really understanding the consumer and delivering great care in the market. So without further ado, Molly, I'm sending it over your way.
Thank you, Phil. I really appreciate that. Yes, Molly Luton here. To start, I want to give you context of my experience. I had experience in healthcare from the very beginning. I had the fortune of being raised by a physician in South Florida. I've always grown up in hospitals, grown up around hospitals, and really felt like that was a place I wanted to spend my career. I have a master's degree in integrated marketing and communications from Georgetown University and have spent about 16 years in healthcare marketing and communications. I choose to do what I do because I believe in it. I believe in the mission of Ballad Health, and I believe in what we're trying to do as an industry to impact the lives of the patients that we serve. So Ballad Health is a health system that came together in 2018. We're the product of an in-market merger. If you can imagine a Coke and a Pepsi coming together, serving the same types of customers, but highly competitive, that was us. We had two health systems that were barely surviving on their own. One system put a for sale sign in their yard before the other, but it wasn't long before the second one probably would have done the same. We had very similar cultures, very similar medical staffs, patient outcomes, all those types of things. The payer mix was very similar. And we really decided that instead of one health system being bought up by somebody else outside of the market that didn't know our patients, we would instead come together. So we actually have what is known as the largest state action immunity compliance program in place with a federal antitrust law support of our merger. We have the largest certificate of public advantage in the state, which a lot of people refer to as a COPA, or rather in the country. And so it's a really unique situation where we committed a series of big standing goals over the course of 10 years that we would impact change in the region that we serve. So we have 21 hospitals, a children's hospital, primary care practice, a multi-specialty physician group of about 600 physicians. We serve 4 states, primarily in Southwest Virginia and Northeast Tennessee, and we have an extensive retail network as well. Next slide, please.
So Molly, I think with that background, it suggests that you sort of had to be able to take a different approach to how you were going to deliver healthcare.
That's right, absolutely. So with the approach of the promises that we made to the states that essentially govern our health system in a lot of ways, we really realized that the uniqueness of serving a population in rural Appalachia is not that dissimilar to some of the communities and regions that you all probably serve. But what might be different about us is that a lot of the health outcomes, a lot of the things that make our patients unique are compiled in this area. So you'll see here on the screen that the health outcomes in the Appalachian region, the area of Southwest Virginia and Northeast Tennessee, are substantially worse than many areas of the country. So as a whole, 7 of the 10 leading causes of death in the United States exist here. So, these leading causes of death that you're all familiar with, cancer, COPD, stroke, et cetera, are things that the vast majority of our patients have as pre-existing conditions. And those are things that we hope to impact change on and promise the states that we would do that. We also have really significant economic challenges in our region. Income, certainly, our poverty rates, unemployment rates, the reading level, the average reading level of the patient that we serve is actually at a 3rd grade, where in many of the communities that you serve, you're probably writing your communications materials at an 8th grade or higher reading and consumption level, and we write at 3rd grade or below. To really connect with our audience. So as we were redefining what rural healthcare really meant and how Ballad Health was going to solve the problem of improving health outcomes, and also with a payer mix that's probably dissimilar to many of yours, our payer mix is actually about 80% Medicare, Medicaid, and only about 20% commercially insured. By comparison, on the center part of the state of Tennessee and Nashville, their payer mix is probably just the opposite. In fact, it is, where it's about 80% commercial and about 20% Medicare, Medicaid. So we have a lot of those things working against us, you would think. We have broadband issues. We have, significant issues with transportation for our patients. And these were all things that the data told us about. The data told us about our expectations for the payer mix and our expectations for broadband, but we really didn't have the whole story of what our patient wanted to know about, how they wanted to hear from us, how they wanted to consume health education and health messaging without having insights and knowledge to tell us the truth. We had some of the story, but not all of the story. So it was really important that, thank you, Phil, that we really took an approach that we didn't have, marketing waste out there. My budgets are more and more limited every day. If anyone on this call has a marketing budget that's growing, please let me know because that's of interest to me. I would be curious to know what you've got going on there. But for us, it's really important that we're spending our dollars in the right place, and we're using what I call smart marketing. And many of you are probably familiar with this concept, but I really wanted to lay it out as 5 key areas of focus for us when we're making decisions as to what we're doing with our marketing dollars. We always want to make sure that the decisions that we make, the tactics that we choose, the research that we approach really has specific intent in mind, that the actions that we take are measurable, the tactics that we select provide messaging that produces action, that someone is reading our message, clicking on our content, and they're taking action, that obviously it's relevant to the consumer, it's relevant to the patient, and then there's a time-bound element to it. So we don't want things that are just sitting out there forever and really don't have the elasticity of a time, tied to it. That's important to us. So, as we set out these goals and set out this kind of methodology of really using smart marketing and not having marketing waste, it was important, again, for us to have front-end research to tell us what our consumers really wanted to hear with these messages, and not just think about what we wanted to say to our consumers, but rather what our consumers wanted to hear.
Wonderful. So as I hear you talking about research and insights. I think this is a great time to let David introduce himself and bring him into the discussion specifically around, how insights and ethnography go together and allow to really collect this data and understand your patients from that point of view. So David, would you like to go ahead and introduce yourself and talk a little bit about the methodology behind between insights and ethnography. Pardon me.
Yeah, gladly. So, Molly, thank you. I'm David McDonald, one of the founders of the LIFT organization and a healthcare anthropologist. Molly, thank you for that. I always enjoy hearing you talk about the work we do, and especially your system and the COPA. So a little bit about insights and ethnography. Let me give you a little bit of background first. It goes back about 8 or 10 years. I won't take that long, but but I was working as an ethnographer in pharma, and I was really impressed at how much emphasis and focus these healthcare companies placed on deep qualitative insights. Their devotion to empathy clearly drove commercial as well as what we call post-marketing strategies in the pharma space. LIFT works both in pharma. We work with pharma, hospitals, health systems, academic medical centers, and even in the device spaces. But anyway, these guys in pharma truly champion this deep contextual understanding of the stakeholders that are in the transaction. Don't get me wrong. I saw firsthand that pharma wants to sell their assets and they want to see them being utilized. They want to, generate revenue, but there was a palpable mission to understand the lived experiences that fueled not just prescriptions and refills, but that fueled for successful behaviors and better outcomes clinically, socially, and financially, right? So it made perfect sense to me as an anthropologist sort of coming in from the outside or from the hospital point of view, as it were, because at the time, the world of hospital marketing was focused on selling, and the objective was revenue and market share, and the marketing team owned the entire practice of marketing, and so it was like I was observing pharma seemed to be focused on the entire experience of every stakeholder in the transaction, and hospital marketers were focused on transactions at the point of need and generating volumes and revenue, and not a bad thing, but the tactical approach of hospitals was grounded in quantitative data that fueled what I believe to be an irrational devotion to digital tactics. And so, hospitals would use the word empathy from time to time, but none of them practiced it like pharma. In fact, the hospitals that we were working with during this time were sort of drunk on SEO, SEM, and all that stuff that happened after, Steve Jobs signed off on the iPhone. So we were stuck in what I would call this pattern of technological solutionism, and we seem to ignore or not even acknowledge, I guess, the notion that extreme stakeholder empathy might just be a valuable tool in informing strategies, right? So it compelled me to this question, and which takes us to the next slide, and is how can we healthcare marketers, movers of emotion and behavior, how can we leverage empathy and stakeholder understanding to get more? We want that in terms of business outcomes, but also to do more in terms of understanding and engagement, education, and consumer empowerment, and of course, focus on the KPIs. But marketers are busy, as Molly just said. I mean, it's like service lines, market share, physician engagement, recruiting, internal stakeholders, blah, 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 programmatic, SEO, SEM, a dozen other demands are calling your names every day, right? It's like death by 1,000 cuts oftentimes. And our hospitals would come to us and say that they felt caught in this funk, between the foundational challenges of their work as marketing professionals, which is what Molly is, and which is what many of you on this call are. But more, they were interested in this pull towards this nuanced challenge or responsibility as a healthcare marketing professional. And there's a difference, over and over. Our clients shared and still share this desire to provide more than just a marketing message, directed towards getting a hit on revenue. At the time, they were hinting at this aspiration to understand the consumer, to make more a positive impact on the overall health and well-being of the community. And as we sort of explored this funk, if you will, and looked at ways to incorporate the pharma way into hospital marketing without the budgets, sadly, we learned that this evolved aspiration that Molly and others of our clients had, in early stages of our business growth, involved the balancing of two very important aspects of business. And this is important. The first aspect is financial, and the other is economic. And we all know that finance and economics are closely related disciplines in business and in strategy, but they're not identical, and hopefully we know that. If we don't, I'll teach you that. So health finance, basically healthcare finance, is focused on revenue. Hospital finance, costs, profits, how funds are generated. The financial objectives are grounded in the dual roles of hospital operations and money, keeping the doors open and paying the bills, if you will. Hospital economics, on the other hand, is championing human behavior, community, lifestyles, positive health outcomes, understanding. The economic objectives are grounded in the dual roles, to use that term again, of the healthcare provider and the patient and the community, and connecting with and empowering the consumer, if you will. And as marketers, I would ask everybody here who works at a hospital, in a hospital, especially as marketers, but especially healthcare marketing professionals, is it possible that we can live at the intersection of both of these disciplines? You know, we all know that financial objectives and KPIs are crucial for our hospitals. Keeping the doors open and paying the bills is it's tough. For sure, your CFO and your CEO are very concerned about generating income and profits, if at all possible, and monitoring spending. There's no doubt. And I can assure you that they, your CEO, CFO, and your brand and your board are also very concerned about the economic mission of healthcare. In going back to what I said a minute ago, in connecting with and empowering the consumer, I think is what I said. So that's, I think, lays the groundwork. I believe the economic side carries more weight as an anthropologist and as a scientist of sorts, an engineer. We like to say at Lyft that we engineer marketing. And this is why we champion ethnography and qualitative insights along with quantitative, but what's known as mixed methods research as foundational to hospital marketing and strategy, to healthcare marketing strategy. I mean, all of our clients, we don't have clients that don't start with this, because it's not how we work. So let's talk a little bit about ethnography. So really, and I think, Phil, you would probably ask this question if I would shut up, but how is ethnography a better research investment, maybe, is what you might ask at this point, right? Here's the deal. Many healthcare marketers and strategists, they believe that numbers are a far more superior form of knowledge than stories. This is uninspired and it's short-sighted. All numbers need interpretation and scrutiny. And if they want to be understood and actionable, numbers need stories. So if you think about what we do as hospitals, much of the traditional qualitative research that hospitals are investing in looks a lot more like quantitative data. It's void of any real context and story, no true human understanding. What I mean by that is most hospitals and health systems are investing in focus groups and surveys and digitally collected data, some open-endeds or whatever, to inform their strategy and creative. And these two methods absolutely do not produce the thick data that leads to the stories and insights that fuel what we call at Lyft strategic and creative velocity, that fuel the mission that Molly is on, to connect with, engage with, and empower her community to a higher level of competency, and also to capture, the market share at the appropriate level of intervention and things of that nature. So ethnography, basically, what is it? It's a function of the science of anthropology. Ethnography explores cultural phenomenon from the point of view of the subject under investigation. It seeks to understand the lived experiences and attitudes of the stakeholders, the subjects at ground level, if you will. It places the stakeholder, the participant, as the expert at the center of the conversation. And it's super valuable. It provides qualitative perspective, thick data, as many like to say, oftentimes providing never before seen perspectives and insights, while quantitative data, on the other hand, is fantastic. Look, we have a lot of really high value data partnerships that we leverage into what we do, but in the quantitative world, it's beneficial for sure, but there's one flaw. It's devoid of context and emotion. So when we blend a little quant with a little qual, we have this powerful combination of I'm not quite there yet, Phil, but I was gonna add one more little thing. But when we blend a little quant with a little qual, I'm kind of ad-libbing here. we have this powerful combination that will satisfy the most discerning strategy or business or healthcare executive, I promise you, and it'll change your life as healthcare marketing professionals, as it has done Molly's. So on this slide, so there are 6 things listed here that do a great job of explaining the benefits and characteristics of ethnography. We'll share this, but the one facet that I like, that I think that I'd like to emphasize, is this one of ethnography being inductive. As a researcher, I can use observations and evidence in the moment or patterns to make a broader conclusion and even delve further into the topic in a moment. Basically, what I'm saying here is ethnography feeds off of inductive reasoning, if you will. But most importantly, ethnography is where we get the fuel that we need, what we call out this Rosetta Stone that fuels this strategic and creative velocity. So moving on to this next slide. So when we do ethnography, we get a lot of data. We get a lot of thick data, as they say, and we have to sort through that and make sense of it. And this is where what we call the 5 dimensions of emotional truth kind of come in. You can read them here for yourself. I won't go over them, but this is a great way to start organizing data, to start to build tools around the data. And it's a good, we use it as a first level analysis, but we believe in emotional truth to be a core experience or a psychological state that leads to, that lends insight, I should say, to deeply held beliefs and desires of an individual within a given situation or topic. And when we use our insights canvas, this framework here is very helpful. It's again the first order of analysis to group findings into these 5 categories from the perspective of the stakeholders, helping us start to frame thinking that leads to strategy, tools that lead to strategy and creative.
Molly, I know, pardon me, David, just jumping in. Molly, so, David just sort of outlined how we take the data that's produced from both qual and quant research and then sort of quantify it through this lens. I think you have an interesting perspective from within the health system on how you think about the 5 dimensions of emotional truth. Would you like to jump in for a moment and share that?
Yeah, absolutely. I would encourage all of us who are sitting here listening, thinking about what your consumers' needs, motivations, fears, beliefs, and hopes are. As I'm building out my understanding of my audience, I'm building out my campaign planning. It's important for me to understand their needs, the patient's needs, their motivations, fears, beliefs, and hopes of experiencing my brand or the service offering. So I would really encourage you to think that way, as it's a way that I have found some more empathetic, success in our marketing planning. And it's something that I really ask myself every time as just a standard process in my head.
Thank you for sharing that.
Yeah,
so
thanks, Molly. And there's a lot to this. I mean, the quantity of data that we get in ethnography and qualitative research is abundant. Trust me. And again, it fuels that strategic thinking, the resources and tools that Molly's going to share here in a minute. But also creatively, it provides a lot of resources. So as we further distill our learning into these resources or maps, or we end up with a multidimensional, sort of very powerful, very valuable set of resources that Molly can use. But what does all this mean, right? So what is the implication of this sort of reimagining of the role of healthcare marketing and maybe trying to, bring a big pharma perspective into hospitals and health systems? A lot's changed, but, thinking back a second ago, I said that a few years back, hospitals and health systems, and still many are, focused on selling service lines, generating revenue and market share, and the marketing department owns the entire practice. Well, things have changed. I mean, this reimagining sort of has changed what we're doing. The objective is the focus is to understand and not just sell. The objective is to sort of empower stakeholders. Molly talked about the literacy level that they operate at and things of that nature. And they have to think about these folks in their communities along those lines, because it's not just about generating revenue for them. It's about also taking care of this community in a way that keeps them well, or at least, again, gets them into the system at the appropriate level of intervention. And the ownership is not just in Molly's department. It's across the entire organization, across the entire community, advocacy and all. And the place in the process is embedded in, as Molly's going to show you, in these maps. It's embedded in the realities and these relationships that unfold, not just at the point of need. So I hope that helps. I guess the close of all this, I would put a point on this tactics and content, right? Clearly, the tactics have changed. Insights at every level on all sides of the transaction inform strategy and tactics. And this is where Molly is making tremendous inroads into the work she's doing in the market. Is that okay?
Yep, thank you. So Molly, now that the table is set that way and we kind of hear the process, the science up front and your philosophy, take us to the next step, if you will.
Absolutely. Thank you. So for so long as marketers, we feel like we know what the consumer wants to see, what they want to hear, and that they want to have a stake in the conversation of their healthcare journey, right? But do we really know that information? And so for me, using the term consumer, I think is an important one when on the patient journey, a patient is only a patient a portion of the time. As a brand, I want to make sure that someone is consuming my message all the time and they know how to come to us. They know how to access us. They know they can trust us when they need us most. Healthcare is one of those things that in the consumable goods world, you're selling a product that someone usually seeks when they want it. In healthcare, you're consuming something oftentimes because they need it, right? So that makes what we do a little bit different. So I think keeping this in mind, keeping the idea that the consumer wants to be seen, heard, and understood in their healthcare journey is really important. Next slide, please. As we went into the process of trying to understand our patients post-pandemic, right? We're kind of all in that space right now. We're trying to understand, is the patient today the same patient that we all cared for 5 years ago? No. And if you're treating your patients the same way that you were 5 years ago, you're probably finding yourself in a pickle right now. Healthcare marketing communications, as David was saying, is not just about the brand, it's really about the experience. And so we can't understand the experience unless we can understand the people. And so what we did, going back to last year, actually, we started this journey with Lyft where we wanted to do some qualitative and quantitative research. We used this mixed method approach. We surveyed about 400 people in the Appalachian Highlands region, which again is Southwest Virginia and Northeast Tennessee. We had online surveys that were targeted. We also had in-person Zoom meetings that took place where we had research done, trying to understand what the patient's journey was, what kind of language they're using, what they relate to, what their fears are, what their barriers are. And we created this whole approach of personas. And I think many people are probably familiar with the idea of what a persona is, but the idea, if you're not familiar, is creating these semi-fictionalized characters, if you will, that have kind of broad characteristics that are really similar to many of your patients. You're kind of bucketing your patients or your consumers together in similar ways so that you can better target them. These are just a few examples. These are proprietary. This is our information. So what's relative here is not necessarily relative to you all because you're serving different types of patients in different parts of the country, I presume. But what is similar here is that we really distilled the patient's persona or their profile down to some key areas. We tried to understand what are their critical needs, what are their expectations, back to the 5 dimensions of truth. We tried to understand their fears and their beliefs and their hopes for the care and the experiences with our brand. We wanted to find out what their challenges were. What are their pain points? Is transportation a problem for them? Did they have a past experience in healthcare that brings them fear? In which case they don't want to go back? Did they lose someone during the pandemic that was close to them and they're now even more afraid than ever to go back to a hospital? What kind of behaviors are they seeking or avoiding? That was an important one for us. And really overall, what is their experience with the particular service line of primary care, which was what we selected to start off with. We really felt like, quote unquote, post-pandemic primary care is kind of our new front door again. For so many years, it's always been the ED, the emergency department, and it continues to be. But from a retail perspective, as Ballad Health mission is to essentially improve the health and wellness of the region, not just the patients that are in our hospitals, it's the region, it's keeping people out of our hospitals. We really felt like primary care was that step one. And so we did this research study to really understand our primary care patients first. So we built out these personas. Next slide, please. Then what we did was we worked with Lyft to develop this language map. And if you're not familiar with the language map, hopefully you can see it here on your screen. But the idea here is, to better understand the behaviors, the specific stakeholders of those personas, of those people, those patients that we've grouped together. To orient yourself here, what you're looking at is on the very bottom, there's 5 key phases of the journey of the patient experience there on the bottom. And when I say patient experience, I don't necessarily mean, when they're admitted to the hospital and when they're discharged and receiving their bill. What we're talking about here is really that transformation of the patient deciding to engage with your brand. So, is the patient asking themselves what the experience is like when they're presenting the need for care? They're then searching online, presumably. They're having conversations with, loved one about where to go to see a primary care provider in this case. They're evaluating those decisions. They're evaluating those choices. They're looking online. They're trying to, compare what options are out there. They're then making adjustments to their environment, and then they're trusting that relationship to be established with a primary care provider. So what you see here is different quotes, different anecdotal messages that have come from the patient experience or come from our research with patients rather, regarding their languaging, the work and the words that they use when they're describing their fears, their behaviors, what the things that they're avoiding when it comes to healthcare, and the things that they're trying to adopt. One thing to note here is, as you're looking at this map, is avoidance behaviors are not always a bad thing. In some cases, you'll see here that avoidance behaviors could be things like avoiding the use of excessive alcohol consumption. A seeking behavior, as you'll see there on the top, that line right there, that could be seeking something, some element of support. So they're not always bad things in those categories. They're just good things for us to know. And again, these were kind of anecdotal snippets of things that patients really said and really feel about their experience. Next slide, please. So after that process, again, utilizing the research, the qualitative and quantitative research, we worked with Lyft to create this journey map. If you're not familiar with the idea of a journey map, I'd really encourage you to kind of play with this process. As the pandemic has simmered, today we only have 12 patients with COVID at Ballad Health, which is really the lowest number we've had in 3.5 years. So we're very excited about that. And hopefully you all are in similar positions right now. But we had to reset, what is the patient's journey like right now? We might have different business goals in mind as business owners of what we want the patient journey to be, right? We might have these grand plans. We've all, integrated a lot more tech into our world, which is phenomenal. But just because we have those business goals in mind doesn't mean that's actually what the journey is like for the patient. And so for us, it was important to kind of go through this process. And so again, this is drilling down deeper, and hopefully you're able to see this well enough, and we're happy to share this. Again, this is our information, so it might not be fully relevant to you, but the concepts I think are really transferable, where a patient is, trying to understand what their need is. They identify that they have something wrong. They identify that they need to see somebody, but they have high anxiety, perhaps. They're afraid to come in. They have transportation barriers potentially, but they don't know, they don't know the answers, but they know they need some help. They're then going through that consideration process, which might take a couple days. And they're really trying to understand what the provider's background might be. What kind of provider do I need? That can be really scary to assume you might need one, area of specialty versus the other, and just not knowing that. And so you're going through that consideration process. Then, eventually, hopefully that patient will choose the provider, and they'll begin that engagement, and they'll assess the quality of care that's provided, later and then hopefully ongoing. We certainly have a certain care history in Appalachia where patients are coming to primary care providers once in a blue moon. They're not establishing a regular occurrence of patient care. And so for us, it's not just getting those patients back in that front door post-pandemic, it's helping to build that relationship. And so if we have an understanding of what their core values are, what the expectations are of our patients, we can figure out ways to communicate the relationships that they can expect. So this is really a visual, an understanding of how things can go well, what barriers there might be, and what those consideration options should be as you're considering your messaging. I think it's really important that not only the business goals are at play here, as David was saying earlier, with the financial and the economic drivers, but that the brand goals of creating a good experience work together. And that's ultimately what we're trying to do. We're really trying to, not have a differentiation between our financial goals and our experience, that they're really on the same page. Next slide, please. So we've had those tools, all those things are in play. We've done the research. We've gotten to a place that we have a pretty good understanding of who our patients are. We ended up building out 8 different personas in our own research. They vary, everywhere from the patient who really likes us, who has high utilization, to the patient who might live in our area, who isn't as favorable of my health system, and has low utilization. So we have a whole spectrum of patients, but every single patient, in my opinion, deserves to be thought about in these ways. We want to ask ourselves, as deliverers of healthcare, as someone who delivers a service to someone who needs us, not just someone who wants us, what are they thinking? What does that consumer, what do they think about my brand? What are their, again, back to the 5 dimensions of truth, what are their fears? How do they feel about us? How do they feel about the trust they can, have in the care? So what are they thinking? What are they feeling? And then ultimately, what is my consumer going to do with the information that I provided to them in my marketing messaging, for example? Really ensuring that you're answering these questions. After you answer those questions, in my opinion, the next thing to be doing would be, flop those business goals back on top. It's not just about what the business wants the consumer to think, feel, and do. It's with these insights, it's what does the consumer think, feel, and do, and how can I build my business goals on top of that? So in my opinion, it's kind of you're re-engineering that process, where rather than letting the business drive the consumer, we're letting the consumer drive the business. And if you're not thinking about business from that perspective in this day and age, in any industry, I think you're going to be sorely mistaken. The consumer has a lot more power than the businesses do. And so again, thinking through the think, feel, do process is something that we've been doing, and it's really important to assess.
So Molly, this is really fascinating. We've basically looked externally, set the objectives and goals, really gathered a deep understanding, quantified it through tools, but that's really only part of the story, right? So now you have to bring it into a complex organization operationally and bring it to life. So that, to me is sort of the now what portion. Mm-hmm. So where, as you're sharing with your colleagues here on this webinar today, where does your brain go? Once you have these tools and they're armed and ready for you to execute strategy, where do you go next?
Yeah, thank you. So I ask exactly that. What's next? And my first question is almost always, is the business ready for the business? Is this service line, hospital, physician truly ready for the business that hopefully my marketing will drive towards them? On a personal note, I don't think any of us would probably put our homes on the market, allow photography to be taken and put on Zillow if our, roof was falling apart and shingles were in the front yard and the fence was falling apart. And that's how I look at, my service lines that I help support. I sort of look at myself as a support department. Is the home ready to be sold on Zillow? Is the business ready for the business? Is the service line ready for the consumer? Would I ever want to sell something to someone or invite someone over to my home if it was not ready for them to experience, right? Next slide, please. So this series of questions, there's 2 slides here, and I would encourage everyone to, snap a photo of this if these are things that prompt your thoughts. But these are a series of 16 questions that I, work with my team to think through every time we receive marketing requests, from the CEO to the service line level of leadership to even frontline team members that have marketing ideas for us, is, asking these questions. What is our performance to date in this service line? Who is our audience? As we just talked about, our insights are really informing who our audience is, but oftentimes we find that business leaders, service line leaders, don't really know who they're trying to speak to, and they don't understand their volumes. This probably isn't a surprise to anyone listening, but there's people that I say, what type of patient are we seeing? I can get into the weeds here of, give me the demographic, give me the diagnosis code, give me the zip codes, all those kinds of things. But even before that is, who is your audience? Are we speaking to patients with whatever you want me to say? Are we speaking to members of the medical staff? Are we speaking to the public? Those kinds of things. Third would be, what does our audience want to hear? So again, this is, if I don't understand who my audience is, I probably don't know what they want to hear or how they want to hear it. Do they want to hear it on social media? Do they want to hear it in broadcast media? Do they want to hear it from a physician? Do they want to hear it from a peer? So these are the types of things that I think are really important when you put your hat on to think about the consumer's perspective. Also, what are we trying to say? Again, asking yourself here what our patients want to think, feel, and do, and then what do we want to have our patients think, feel, and do about experiencing our brand. And then lastly on this side is what is our current patient journey and experience? If you're not asking yourself that, which is part of this, is your business ready for the business concept? What is your experience? And be honest, would it be a service that you would want to go to? And if the answer is no, then I hope you feel empowered enough and have a seat at the table where you can go back to that business leader and say, listen, we're not ready. Any volume that I help drive to this service line, it's going to cause, more mess on the PR side to clean up if I try to sell it in this state, than if I took another 2 or 3 months to fix it up, clean it up, get it in order, and then sell it. And I think it's really important to be very honest about that process. Don't just sell it to sell it. And that's really hard. That's a very hard conversation to have because you are trying to meet those business goals sometimes. But as we know, sometimes it costs a lot more to clean up a mess than it is to get it right the first time. Next slide, please. And this is the last set of questions here that I would suggest as a prompt for you and your team. Is this this item that's been requested? If someone comes to my office or pings me and says, hey, Molly, I need a marketing plan. Okay, well, what does marketing plan mean to you? First of all, it's a conversation I have a lot, but is what they are requesting a strategic goal or a priority of the health system? Is this something that's going to move the needle? And that needle might mean financial, but that needle might also mean brand value. Is there a strategic benefit to promoting this, or am I just checking a box because one person had an idea? Sometimes it's important to follow the one person had an idea train, but in this day and age, as our budgets are continuing to be more and more, looked at more and more, it's really important that we're valuing each decision that we're making. So next, asking yourself the value proposition to the patient. We might think we have this new shiny widget to sell to the community, but really, how does it benefit the patient? What problem are we trying to solve for the patient? Who are our competitors in this space? What is the current volume of the business? Is there a provider even available to take on more volume? Is the provider on FMLA? Are they on medical leave for the next 3 months and can't even take more patients right now? Is the patient in a is the physician in a position to open up their schedules? Is the schedule even open to take on more volume, or have they blocked it to 2 half days a week? What is our marketing budget? And then, lastly, and I wouldn't say most importantly, but very much of the importance is measuring success. How are we going to measure all of these things? We can't just throw out all these tactics and then assume that they're being successful, but how are we measuring them, not just in the end of a campaign, but continually? Next slide, please. This kind of brings us to, now we've got everything in order, right? We have our target audience. We have an understanding on the right-hand side of your screen. We have an understanding of the brand, the benefits of whatever we're selling, the values of what we're selling, the features. We kind of have all that put together. And the only reason we have all those things is because we have the consumer insights in the middle, which is what we would call the sweet spot. The idea that knowing your audience and knowing your brand, knowing its value to the patient, overlap in this space that's really special and really important. And if you're just thinking through one of these lenses, you're just thinking through the brand's value and the brand value proposition, but not thinking through the audience's value and their motivations, you're not getting to that sweet spot space and thinking through their lens in an empathetic manner. Next slide. So lastly, this brings us to the execution. And this is the place where oftentimes we find ourselves starting. People come to my office and say, hey, Molly, I need a TV spot. Super Bowl's coming up. I want to be on TV. Or there's an open billboard on so-and-so highway and we need to be on that highway. They jump into the tactic, right? They automatically come up with solutions on their own. These folks who are not trained in the industry that we've all spent many years in, right? And so for me, I'm able to back up, go through that process that I just explained, understanding our audience, building out the language map, building out the journey map, spending that time on the front end, on the research. And then I'm able to really build my audiences. We're in a place right now, we're working with Lyft to do some really innovative and intelligent things where we're not wasting money, wasting marketing dollars, targeting patients that don't want that service. Through a lot of digital tactics right now, I'm not wasting time dropping OBGYN ads to David and Phil. I'm instead ensuring that people like me are receiving OBGYN ads. And Sure, traditional absolutely still has a space, has a place. There's a newspaper, a print newspaper in my area that's a weekly paper, and it still has a 90% readership. So there's still a place for print, but and other traditional tactics. But for me, in terms of really showing that true ROI, we've shifted to about a 75% digital makeup, truly because we're able to measure and we're able to target our patients more appropriately. So what we're able to do is, start with that audience build, which is that top gray honeycomb you see on the top of your screen, and kind of go out around and look at what we can do in the programmatic space. What things can we do? What methodology is out there? How can I pull audience, kind of segments together on the digital space? And, is it geo-targeting? Is it looking on social media, which is that next honeycomb? Is it looking at ways that my consumer is engaging with social media? My consumer still spends an exorbitant amount of time on Facebook. So how can I customize the messages that are on Facebook for those customized audiences to ensure, again, there's no marketing waste and these people are getting the messages that they want to hear? This, of course, is on the paid side. We're not talking about organic, but I think it's still important that you think about those organic and, kind of earned touch points also. Connected TVs, obviously something that we've all been spending a lot more time in that space. And that's an area that, again, we can really look at our audiences and build out content that's appropriate for the audiences that are in those spaces. The benefit of starting with insights is that you're actually thinking about what the audience wants to see before you're creating the content, rather than creating the content and then figuring out where to put it. So, that's part of this whole process here. We're then working with some really unique claims analytics and understanding what types of things the patients are requiring on the back end. And then, of course, lots of reporting. You don't just set it and forget it. Our team has built some phenomenal dashboards, very interactive dashboards, where we're looking at them daily and saying, hey, this post is not performing well, or, this ad content is not performing well. Let's switch it up. Let's try this graphic instead of this one. So you're not just setting it and forgetting it, and you're truly automating ways that patients can engage with you. That is what they want to see, hear, and feel. So I'll stop there and throw it back to Phil.
Yeah, I actually have a question for you, Molly. So I think it's, first of all, fantastic. Thank you for sharing that. I think it's really interesting how the learnings, when you go and hear from the number one expert on your brand, which is the patient, the people who are using and experiencing your brand, and you get that feedback, that you're able to utilize these tools to essentially translate it to all of your tactics. So I know here we're looking at a lot of execution stuff, but I think it's safe to assume, I don't want to speak for you, so I'll let you speak to it, that this informs, your tone, messaging, creative treatment, and it facilitates the opportunity to speak to community members wherever they are in the adoption pathway. So a lot of marketing, to David's point earlier, is really driven at the bottom of the funnel: make an appointment, take an action. But in the research, you really learn that there's a diverse need for information, trust, understanding, and the relationship to come before that transactional action in the funnel. So I just thought it was really fascinating. Maybe it's not a specific or a direct question, but just your perspective on sort of how that created continuity in your tactics, and then allows for you to look at, let's say, a fiscal year and the way it might conclude, and then the way you're building your next plan from a highly informed position with all of this. So laborious question, maybe a shorter answer than the question, but I'd love to hear your philosophy on that.
Yeah. So in a perfect world, we're doing the research on the front end. Think back to elementary school. We did science fair projects. You did the research, then wrote the report, right? Well, none of us live in that world. We're continuing to build the plane while we're flying it, right? If anyone's not doing that, I'm again jealous, because you probably have a growing marketing budget too, in which case I'm also jealous. But we don't have a perfect world of being able to do all this research every single time before campaigns. Oftentimes you're flagged and our volume's down, and yes, Molly, I can answer all the business questions. I need to run something right now. I don't have time. And I think what you need to do at that point is use at least what you have. Think through the tools that I shared. You might not have time to go through the qual and the quant, get a journey map together and build out your personas perfectly, but you can put your hat on that's the consumer's hat. You can ask yourself those questions in the 5 dimension of truth. You can ask what you want your patients to think, feel, and do about experiencing your brand. And so for me, right now I'm in a place where I'm planning for next year. Next year is in 2 weeks for us. So Happy New Year to those of you who have a July 1 FY. And we're doing this approach. We're taking this approach not just with service lines. I have major service lines as my goals for next year, but we're also drilling down into using this approach for internal stakeholders, external stakeholders. For us, recruitment and retention in healthcare is extremely important, extremely valuable. Hopefully all of us have started to engage more and more with our human resources departments and offered our services to those departments because it's valuable. And to me, that's teamwork. That's the idea of using our knowledge for good. And so I'm, perfect world, I'm planning out these insight studies. I'm planning out this research on the front end as my year begins. If you can't do that, again, start with the small stuff and work towards planning a few months down the road to start thinking this way.
That's wonderful. So just watching the clock here, I think we're ready to push forward to afford. We've had some questions come in. I want to afford some time to answer those questions. Before we start that, I just want to say thank you to you and David. I thought that was very interesting, and no matter how much time is allotted, there's you could always go on a lot deeper into all of these topics. So if everybody will bear with me, I'm going to open the question panel. I've seen that number growing while we're sitting here speaking, and I'll try to direct them to each of you appropriately. So David, Molly, you can give comment at the end if you'd like on this, but David, I think this would be just from the ethnographer standpoint. Would you be able to speak a little more or expand on the difference between some of the tools we looked at? So like the language map, the journey map, personas, just give a little bit of sort of the science there and maybe expand on the difference specifically between the language map and the journey map is the question.
Sure. And I want to, in all transparency, I was going to try to answer a few of these questions. A lot came in and I sent Peter an answer about how long it takes to do this type of work from RFP to completed, and the answer was about 4 months. I thought everybody would see that. So, but back to this question.
Let's just go back real quick, David, and just state his question and answer again. Just
thank you. Okay,
since everyone wasn't ready, and then go to mine. That's fine. No worries.
Will you share with us how long this process took from RSP to actionable data and insights? And the process generally will take out of the gate first time through 4 months. I mean, we have several more research projects on the horizon with Molly and have done multiple projects for many clients. And so they get a little shorter each time because we get a little more, traction underneath us, but 4 months is a good answer for that question.
Wonderful. Okay. And then the difference between, so now I'm bringing you back to the first question. Okay. Sorry, got you turned around there. Just share a little bit about, expand on the difference between the tools, like, for example, the journey map.
Journey mapping. And so, so Molly made an important point earlier. These are not journey maps for the digital engagement, although we can do that. This is not what she's talking about. These are journey maps that are situational and reflect on the consumer's journey into and through the healthcare system. And in this case, primary care, she was talking about these situations that lead to the consideration, as Molly put it in the journey map, the thinking processes that go into seeking care and the situational realities that are embedded in the consumer's lived experience in coming to terms with and in seeking care. So a journey map is really more about the situational consideration sets that go into the fundamental high level journey of onset of illness, consideration, choice, evaluation of care, ongoing care. The language map is something that one of our ethnographers built for a project a few years ago, and we keep using them because it's awesome. We in addition to the 5 dimensions of emotional truth, we have other tools in our research, what we call our insights canvas, and this is one of those tools. We were categorizing data in seeking and avoidance behaviors, and as Molly said earlier, there's seeking and these are not positive, negative. They're just people are seeking to do something or avoiding to do something, and that was what they presented to us qualitatively in the context of our research. And so we decided to take those snippets, those words, and put them into a framework that gives us the ability to overlay, if you will, to understand what's happening situationally what's happening in terms of the consideration and the thinking that's going into it, and then what they told us they are doing or feeling or thinking in those situations. And so a language map gives us a deeper perspective around the stakeholders' emotional and intellectual disposition. And the journey map will really give us a framework about how they're encountering these situations and how they're navigating them when they start to consider the fact that they have this thing happening to them and they need to seek healthcare. Is that good?
Yes, sir. Thank
Okay.
you for sharing.
Yeah, thanks for asking that question.
So Molly, this is a partial, I believe you answered part of this, but I'll give you an opportunity to jump in and speak to it more. So the question is phrased along the lines of, can mixed methods research be used for other service lines or other purposes inside of the health system? So you mentioned internal stakeholders, recruiting and retention. Maybe share your philosophy there briefly since you touched on it. And then do you see this as applicable in all of your core service lines? And that understanding that, I think I know the answer, but I'll let you speak for yourself.
Yes, thank you. It should be, yes, it can be, and it should be applied. And I think that, even using this type of methodology on a smaller scale is possible. It doesn't have to be, as extensive all the time, depending on what you're trying to what your goals are, what you're trying to accomplish. But as I said, we're using internal stakeholder research right now, trying to better understand physician recruitment, not just employment and team member nursing recruitment, but physician recruitment. What brings them to our area? What are the barriers of trying to recruit a physician? Those kinds of things. So we're really digging into internal and external stakeholder, and then certainly service lines, cardiology, oncology, orthopedics, trauma, et cetera. Very transferable in lots of ways.
If I could add to that.
Sure. Go ahead, David.
So for sure, this research is extremely valuable under virtually any circumstance. In fact, we've done a lot of service lines, clearly, and stakeholders from multiple perspectives. We've even worked for advocacy accreditation organizations, rather like the Joint Commission. We've done a study for them around certain things that they're focused on strategically. And so there's a lot of application and a lot of value in these types of studies. And as Molly said, or maybe it was Phillip said it, they don't have to be gigantic. It helps. They don't have to be mixed methods. I mean, if you're really looking for the qualitative perspective, you go out and go ahead and start asking questions. And we have some resources. If you email me, I can send you a package about how to be a good ethnographer. So, but the idea is that, it all begins with putting the stakeholder at the center of the conversation and trying to draw out their expertise, because we need to be going to them with a voice that's relevant and engaging, and that can be held accountable, not just to our marketing investment, but accountable to them for spending their time, consuming our content, if you will. And so there are many ways to capture good data very quickly. And it's still somewhat rigorous, but the idea of asking and gathering information is important in any dimension or domain of healthcare, in my opinion.
Awesome. I'll stop you there, David, just because I want to try to get two more questions in. So I think we have the bandwidth to do this. I'm going to do the shorter one first. So Molly, could you give an idea of not how long it takes to execute a study, but how long did it take for Ballad Health to adopt this approach and indoctrinate your team into it, sort of align everyone into this philosophy, which clearly was a change that was aligned around, reimagining how you would deliver healthcare in your market. So what was it like for you internally in this complex organization? Was it 2 cycles, 1 cycle? How did you get, adoption internally for this type of approach?
I mean, truthfully, we were at a place where there was so much new happening. We were restarting post-pandemic, so we were hungry for some change, and it was easy to kind of sell that, which might not be the case for everybody. But it came down to me having table conversations with leaders about how they feel about our brand, how they consume media, how they interact with our services. And when I ask them those questions, they start to think more like the patient. And it's easier for me to then say, hey, so why aren't we all thinking that way in terms of our service delivery, the message delivery that we provide? So in terms of actual time, this particular project, we kind of started discussions about in September, and we completed it in April. And that was all the way through identifying the problem, which took about 3 months, and then kind of 4 months of study and research. In terms of evolving the thought process of the organization, that continues to be something that we do. But we were hungry. I'm so sorry.
Bless you. Bless you.
We were hungry. Thank you. We were hungry for transition. So just being really transparent about what you're trying to do as a marketing leader of shifting the conversation back to the consumer's preference. And I'm happy to talk about that more one-on-one if anyone has any ideas or specific questions.
Okay, there was one question, Veronica, if you're still on, we will answer your question for you offline and share the answer with you. But out of respect for everyone, I see that we are right on the clock. So I'm going to go ahead and just jump here. And then I know Daniel has some closing comments. So I'm going to go ahead and pass it back to you, Daniel, if you're there.
Thank you, Phil. I'm sure the audience joins me in thanking you, Molly and David, for sharing your insights and expertise with us today. Thanks also to our audience for carving out time to join us for the important conversation. Like Phil noted, that if you asked a question that we weren't able to get to, we'll do our best to get you a response. We'll also be sending out a link of the webinar recording in the next couple of days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, as well as the Healthcare Marketing and Physician Strategy Summit. Check the forum website, healthcarestrategy.com, for details. That concludes today's program. Thank you and have a great day.